I hope everyone was able to get the 2 articles out of Trauma-Focused Cognitive Behavior Therapy on telehealth. I thought it would be a nice platform for us to review and then think about how it may be relevant in our application of telehealth with PSB-CBT. As I mentioned earlier, I'm going to have a PowerPoint up that summarizes the materials, but I really am hoping that this journal club can solicit discussions among us to share ideas in terms of what's working in this application. Feel free to put questions or comments in the chat bar, and then I'll stop periodically for folks to be able to unmute and share. It does really help that everybody has themselves on mute now and reduce the background noise. So we sent out 2 articles out of Trauma-Focused CBT out of a team in South Carolina who are experts in Trauma-Focused CBT and utilizing that model then in serving our communities that may have more difficulty in being able to be reached with the face-to-face contact. So they addressed a number of reasons why telehealth can be useful, shortage of providers in rural communities being one very large one, and those providers being charged with being experts in a wide range of services, so being able to bring in telehealth with other experts and address even cultural congruent services in those areas being important, and recognizing the multiple barriers there are to face-to-face services in terms of location, transportation, child care, time constraints, finances. And then, of course, the obvious for all of us these last couple weeks is as we cope with COVID, with our need to be able to be safe and have the distances we need. Many of our states now are required for us to remain in home except for essential things like grocery shopping. It is a time of great need for our families because we do know that social isolation and stress are 2 enormous risk factors for families in child abuse and neglect and overall impacting well-being. So the more that we are going to be able to be available and have access to our families, the better we can be responsive to their needs. So we at our center have been looking at this as also a potential opportunity to build a process of doing telehealth to address problematic sexual behavior of youth moving forward even after this is resolved. So always trying to find the silver lining of things. It's going to hopefully help us be able to serve our families even better. So articles come out of South Carolina's COPE program, Community Outreach Program. I'm afraid I'll mispronounce Esperanza, which I looked up means hope, which I thought was a really neat name for the program. These are providers trained in trauma-focused CBT, and the COPE program is a community-based in schools and communities, and then with telemedicine being able to provide it further in there and in home. And part of the efforts for telemedicine was that in their own assessment they were finding 25 to 40% of the work time of clinicians were traveling to or from appointments, that with telehealth they could even serve more families. And how they defined telehealth was using video conferencing for real-time audio and visual technology and making sure it's administered through a secure and encrypted connection. So the article is divided into 2 parts. The first part being all the processes for establishing the program, and then the second one is adapting the TFCBT model for a telehealth mechanism. At first, what they talked about is the need to establish and utilize the community partnerships. So one of the means of doing telehealth for their program was that the child and family access the technology at a school, at a faith community, at a service center that didn't otherwise mental health, had a room that was safe and secure with the appropriate technology, a person to help orient that, but then in that closed room they would access the through the technology. So that's one thing for us to think about is, can we establish those relationships with community partners to be able to especially serve those families that may not have the technology within their home. In doing that, one of the other pieces that they mentioned is the importance of having a memorandum of understanding established, who's going to be responsible for what in that partnership, and they gave an appendix example there for some of the language that could be part of that memorandum of understanding. Piece with this access that I thought was interesting for both the articles was being careful to make sure you have strategies to address the caregiver. One of the downsides, it sounds like, for the school-based is that the child would be able to have access, but it was more difficult at times to access the caregiver. So needing to think through how we can be creative, because we know from all the evidence that caregiver involvement in the treatment is key for outcomes for PSB-CBT. So thinking through those particular pieces. Before we go on to the equipment, I wondered if there was any questions or comments or thoughts about partnerships and the memorandum of understanding, if other folks have had strategies in these areas that might be useful for the audience today.
This is Paula Condo.
Paula?
Hi, I had trouble joining, but I came in, so I missed maybe your first couple of slides, but I just wanted to offer, we've been kind of dealing in telehealth for a while now, and we've been doing some trainings for this, and we've been doing PSB via telehealth now since July. I think I had my first client, and so be happy to provide resources or thoughts to people. But for the parent piece, we've been doing it just, almost in just the same way you would do family, individual. And so, sometimes parents are on, sometimes the kids are on, sometimes you have them in jointly. It can work really, really well. We've had my very client that graduated from it was a PSB client, and it just felt really cool. I mean, the mom cried and said, you gave me my kid back, and you can be very successful, and it can work really cool. So we've developed some good tele resources around PSB.
I'm so glad you're on and shared. We've heard the other team we've talked in North Dakota also working in telehealth. So it helps to hear that you've been successful in it. I would love for you to chime in throughout this hour on ideas. Any of the resources that you are willing to share, feel free to send to us, and we could distribute out to all the audience. Was there anything in particular you wanted to share about the setup with partners to make it a reality? Are the families accessing it from their home, or are they at schools or service agencies so they can access the technology?
We've done both. We were fortunate enough that when we started our telehealth program, we were able to get a large grant, and so we did a couple of things. We purchased data-enabled iPads and then also laptops. And so if it was going to be seen at school, they get a laptop because a laptop can connect to a landline. And a lot of schools don't have the best internet. And if they do have good internet, a lot of times there's firewalls and different kinds of things. And so, so the laptops can work well in schools. We still include the parent piece, by the way, in both areas. And so parents are mandated to attend all the sessions just as the kids are. And so I'll talk a little bit about that, but also then the data-enabled iPads were for the kids who did not have a device, a webcam, or good internet service at home, and so they can check them out, and we loan them to do just the services. They're completely locked down, and so all that's installed on them and all that they can access is the platform that we've installed on them. And so when it's time for their session, they just push the icon, and it connects them to my virtual waiting room. And so, and then I can see them and hear them. They can see and hear me. And so that's what we've done for technology is we've made it available for those families. We had some situations where that didn't work out. And so, for instance, and this wasn't a PSB case, but they were doing a TF case where a therapist in Fargo was seeing a kid, and they happened to move to my community. And where they moved in my community, they didn't have access to the technology resources, and so my organization use our technology. And so, like you said, we have a sample and memorandum of understanding that we use for, say, if a kid's going to go to a domestic violence shelter and have services there, or we also have a memorandum of understanding for the school, so everybody understands what their roles are and what the expectation is, is. And so the interesting thing is that we've seen who are like, absolutely, we'll help out any way we want, or any way you want, just tell me where to sign on the line. And then you will get people who are just like, nope, and they won't talk about it. They won't have a discussion. It's just not happening. We've had a couple of schools that were just like, nope, it's not better. And so, you have to really work on building those relationships and those partnerships. But most people we found, we've been able to find some sort of answer for them to have technology. For instance, with this COVID thing going on right now in North Dakota, and we're in a lot of places across the country, students getting like Chromebooks sent with them or some sort of device sent home with them so they can do schooling. And so then we've worked with schools to make sure that they can also access and that their counseling services on that and receive services that way. Good question.
That's fantastic. I wonder, so in terms of the technology, resources, equipment, video conferencing, we're using or beginning to use Zoom, and then our campus, we're starting with Ameriwell, a resource. The article talked about using Adobe Connect. It even mentioned FaceTime. All of these, of course, you have to make sure it's appropriately safe, encrypted, HIPAA compliant. I wonder, Paula, what's equipment and video conferencing software you've been using, and how were you able to determine if it met the criteria needed for it to be safe and used for behavioral health services?
So you can get Zoom, and you can get Zoom Health Court Care, which is obviously more expensive. Zoom is not HIPAA compliant, and of course during this crisis they've kind of waived that requirement now, but I would just suggest to everybody that you want to start off well. Yeah. You want to be able to sustain this and continue this, and so I would look for that HIPAA compliance. When we've been going around and doing trainings, again, there's many platforms. We're recommending 4 different platforms. One of them is video, and it's called Video Connect, and that's what MUSC is using. We checked into it. It's a wonderful program, but I think you have to big university or big hospital, because when we checked into it, it was going to cost us like $25,000 a year, and I don't have that kind of funding. So we in North Dakota use a program called VC, so it's V and SEE. They actually have a free program and a paid for program that are both HIPAA compliant. We were using a free platform until COVID took over and crashed the internet, and so they have disabled their free program at this time just because it crashed it so bad. We're hoping that they go back someday, but their paid version is about $50 a month. The healthcare, my understanding, is $200 a month. Then there is Me, which I know a lot about, but my understanding that's about $50 a month as well. And then that video is the kind of the programs that we've kind of vetted. We do actually have has a GoToMeeting now that is HIPAA compliant, and so we do use that as a backup when. So the other thing that we've discovered during this whole crisis is that everybody's trying to use the internet and everybody's trying to do this suddenly, and so it's really a good idea to have some sort of backup platform, because there's been twice now in the 2 weeks that we've been, because weeks ago we went to everybody's tele. Everybody has to stay home, so every client that we see is tele now. And now where our VC was shut down for the entire day because so many people being on the internet, and so then we were able to use our backup of our GoTo account. Thing to be aware with the video conferencing software when you're looking at them is that you need a video conferencing platform for every therapy that you have, unless you're going to, 1 o'clock and I'll do a 2 o'clock. If you're going to kind of stagger sessions like that, it would work. But anytime you have sessions at the same time, you're going to need a platform for every clinician that does this, if that makes sense.
Absolutely.
When you're talking about it's like $50 a month, you have to times that by how many clinicians that you have.
Exactly. And for our company, in terms of Zoom, what my understanding is the Health Sciences Center and Zoom also established a business associate agreement that facilitates also the use and being HIPAA compliant. And so that's another consideration as you're determining which of the video conferencing softwares you're using, if you can establish the business associate agreement, and also determining whether or not you're going to record sessions or not, and that having another layer of security that's needed.
So all HIPAA compliance firms will use a BAA. So something to know about that is that I've been hearing from people across the country is that it's not a seamless or very quick thing to get. It's not like you say, oh, I need a BAA, and they send it to you 2 seconds later. And so when you're researching this and trying to do this, make sure that's at the top of your list, because some people have been saying it's taken a week or 2 weeks to get that signed.
Right. So chatted in Doxy, DOXY.me, also a free version. And then I heard someone else was going to bring in an idea. Who is that?
Denise from Connecticut. So I was actually just going to chime in about Doxy.me, just to add in that in researching them, it says that they also meet worldwide security requirements. So I was using Zoom through my through Sarah, and I should also just clarify, I'm doing that for my private practice, not doing it for the work through Connecticut. But Doxy.me seems to be just a platform that people have reported having good success with.
Thank you.
Mm-hmm.
Any thoughts, recommendations around equipment, technology, ideas of supporting families who may not have the technology in their home, video software? Go ahead.
This is Rachel Sheffett. I just wanted to ask if anybody knows if FaceTime is HIPAA compliant. I've heard different things from different places. FaceTime, HIPAA compliance of FaceTime?
Is not HIPAA compliant.
Okay.
It waives the requirement right now, so some people are using it, but it is not HIPAA compliant.
Okay, great. Thank you.
The things I think I can share is, so like I'm part of this, me and Nicola, Dr. Herding, who is from Fargo Center, and then Reagan Stewart, who developed the research on this. We are part of a training collaborative, a group, the three of us, and we're putting on some training, and we're developing a manual and do have a whole section on equipment with links to equipment that can be really helpful to use. I can send that to you, Jane, and you can make it available to other people, but it talks about what do you need basic, what would be helpful to have. Like, it's really helpful when you're doing a telecall to have two screens. You need to have a speakerphone and a web camera, and we kind of say what are the specifications of those pieces of equipment that would be really helpful to have. So I can send that out to you, and you can share whatever that.
I think it'd be really useful. We'll get in a little bit of talking about how to use the technology effectively to keep them engaged, utilize activities and so forth. So being able to have that information about specifications would be useful. Also thinking about the physical setup, your room, their room, the conversations with the caregiver and the child on how to make sure it's a private room in the home. With the whole family now being in the home, there may be some challenges to that. This is a particularly sensitive topic, and they may have extended family or other people in the home, how to make sure that it is in an isolated part of the home and privacy can be respected. And for the older children, how to be able to have the conversations with the youth separate from the caregiver, but then bring that caregiver back in. And then I think another piece particularly relevant to the PSB population is if you're having a session with a child and they are on technology and we are working to help use technology appropriately and not access inappropriate things on technology, is how do you have all of those safeguards set up so that the technology is back in the hands of a caregiver when it's done, and being really considering about all those aspects of the setup. One piece in terms of your own setup, rather than being an office, many people are at home doing this. Zoom and probably other have platforms where you can change the background. So you could change the background to be a calm scenery, a sunset or something else, rather than them seeing the inside of your home office or living room or wherever you can set it up. You're also juggling your many things. Nuances about the physical setup recommendations that people have.
If you can hear me, just two little comments. I looked up while we were talking about FaceTime, and clearly is saying it's not HIPAA compliant, but I did a request to find out if there's any releases now under COVID that makes it compliant. But on their own statement, they say they don't have a business associate, so it doesn't comply. But then for virtual backgrounds, I just wanted folks to know that APSAC is going to be releasing by April 1st some sample virtual backgrounds with pinwheels and blue and different aspects for Child Abuse Prevention Month. So those should be coming to you, and if you're not a member of APSAC, we can come to you through this group.
Correct. If you have resources you'd like to share, just send it to Carrie Schwab or myself, and we'll send it out to the full group. One piece in thinking about it that I think is important as we consider this is how do we manage crises when we're in a remote situation. So you might have a child who is reporting suicidal thoughts or ideations. You might witness or hear things that make you concerned about a child abuse or neglect report need or safety issue. And so needing to make sure that all of our team members have the knowledge, guides, and protocol to manage crises in these situations. They gave a sample protocol within the article, and we're actually in the process of updating our protocol. Wondered if anybody had any thoughts in particular about thinking about crisis protocol and managing this in the PSB work.
So we have our clients every client that does have, we have them sign and fill out an emergency protocol that designates 3 designated adults that we can contact. So, because it's like, I mean, anything. It could be the kid all of a sudden start cutting in session, or they get violent, or they pass out or have a seizure, and you need to contact somebody. And so we say, we're going to contact the first adult, and if the first adult doesn't answer or respond, we're going to go down the list, and then we're going to contact 911. So, we clients go through that and find that. The other thing that we do in relation to that, because we are seeing kids, is that a parent has to be present or in the home. Not a parent, it could be a caregiver, an adult, to be in the home, and they have to verify at the beginning of every session, so that they have to come in and say hi to me. I have to visually see them, and obviously, because this is a family protocol, there's going to be times in the middle of session, or where it's the parents' turn out to do a piece, or you want a joint session, and so they know that we're going to be randomly calling them into the session, so they're told that they can't leave the home. It's not time for them to go grocery shopping. I'm not babysitting their kid. They have to stay home during the entire piece of the session, and they also have to be there to come into their participatory part.
Do you have a standard end of session protocol strategy so that the equipment is in the hands of the adults at the end of the session?
Well, when we like intake, or when they have that first session, or we're going over the equipment with them, we go over all that. Definitely kids who had internet issues, which is a lot of our PSB kids. What we tell the parents is that they need to keep that equipment, even though it's locked down, and they wouldn't be able to access it between sessions. We want the parents to kind of keep it and put it wherever, in their sock drawer, on the fridge, or someplace like that the kid can't access it in between. We all have, there's time where if we don't feel like the parent is going to provide good supervision and that kid has risky online behavior, so maybe they're posting themselves on, Backpage, or they're using pornography and those types of things, we will require then, or we usually don't try to, if we can, we don't have those kids be seen at home if we don't think the parent is going to supervise that or monitor that. So that's where we'll work with the school, or, so all they have access to is that one that they're with us, and then the equipment gets taken away right away. We've had to do, different kinds of things and situations to make sure that we're limiting the amount of time that they might have risky behavior. But we do also have like a little checklist that we go over with the clients about the care of the equipment, like that they can't take any pictures on it. They treat it just like it's their own. I can't remember all the, they have to charge it in between sessions so it's ready to use. Different kinds of things like that. They can't access any apps outside of the platform site. So we go over all that with the kid and the parent. That said, could they still play? I'm sure kids are smart,
Yeah.
I very clearly, I closely monitor our data. I get emails if certain iPads are going over our data, which tells me that they figured out a way to unlock the lockdown of the apps and that they're on the internet, because we have just enough data on our iPads that set them through one session like a week per month, right? And so if they start going way over, then then we need to contact them, see what's going on, because they clearly have gone on and they're watching YouTube, or they're on a porn site, or they're doing something on it. That said, if you do loan out equipment, it's also really important to have a cleaning protocol. So you're physically cleaning the device, but you're also having somebody checking the history to see if they've gone on different sites. They're checking to see if they've added photos, checking if they've downloaded any programs or any viruses, that type of thing. You need to make sure that all that is wiped off before you would hand it to the next client, because they took it on it, they, touch porn and stuff, all those things are going to pop up when the next client is using it.
Thank you for sharing all of those lessons learned of things that became creating this. Yeah. The next part of the article talked about reimbursement and startup costs, and it really investigating within your state, Medicaid, and other insurance companies. Will they cover telehealth? Do they cover it at the same rate or lower rate? What other startup costs like this equipment? If you are delivering it at a school or another agency, are there personnel costs for that person there to help monitor the equipment and orient the individuals, the families, to the equipment? We have been told in Oklahoma that we are going to be able to charge for telehealth visits given this period for Medicaid. Is that what other folks are hearing across the country? Are there people concerned about getting reimbursement for this?
We've been getting reimbursement for a while in North Dakota. They also have added additional reimbursement codes since this crisis, so they're trying to make it more accessible.
The piece that we're struggling with is the assessment. So the therapy and an initial intake call, but the assessment procedures, we're still waiting word if that's going to be able to be reimbursed. Have been able to get the assessment codes covered with telehealth? Well, let's go on and talk about some of the therapy delivery modifications they suggested. Some of them Paul has already shared in thinking about privacy and the logistics. One of the pieces is thinking through ahead in your sessions of what materials may be needed that the family may or may not have, and do you want backup or alternatives for that? For example, you're teaching relaxation and you like to use bubbles in that teaching. Do they have bubbles? Look at using the handouts. Paula talked about it's nice to have the two screens so that you can show handouts and materials and be able to have the face-to-face contact. Does your video conferencing equipment allow that? And you know how to load up your activities and handouts, manage all that technology. Rules, Paula shared some of those about use of other technology while the meeting's going on, while the session's going on. Do they also have a cell phone? How is the cell phone going to be managed? Thoughts in terms of activities and how it might be modified in order to be utilized within the session materials. What folks' thoughts were, if you've already implemented some of the activities via telehealth, any tricks that you've learned that you wanted to share, or ideas that people are planning to test out in terms of that?
So, can talk a little bit about that as well. One of the things I've been telling people as I'm training them is that, you know, to really sit down with your therapy staff and brainstorm what would you do in person with this client? Like, what kind of creative approaches do you use? So, for instance, if you use bubbles, is there a way to do that over tele? Because, for instance, with breathing, there's all kinds of breathing gifs online where, like, a flow blooms as you breathe out, and then it kind of closes as you breathe in. There's, you know, a hexagon shape that does that. There's all kinds of things like that that you can pull up and use. And so you can use, there's a lot of kind of different creativity things out there. Mm-hmm. One of the things the client seems to really like a lot is when you play PowerPoint games with them. And we've created a lot of PowerPoint games of you just even getting to know you journey, or, you know, our staff have created a PowerPoint that has questions in it about puberty and their changing bodies. We've you can either download Kindle books or you can scan books. You can't share your scan-in books, but you can use them for your own private use. And you can read them the section right online about the sex ed session. And so we can do a lot of creative things in that way. So we use a lot of books. We use a lot of different PowerPoint games. We use a lot of, you can use a lot of different videos, like the TCON video you can pull up right over Telesly. There's a lot of really cool things that you can kind of do that way. The other thing that our site and Fargo site did together with this company, again, is that we put in there to make teleboxes. Our teleboxes are boxes that are made for each. So one that's 7 to 9. We have one that's 10 to 13, 12, I think, and then the next one is 13 and up. And we, again, brainstormed things that we couldn't think of a way to do that, the creativity online. And so we put a box. And so, for instance, bubbles was one. Everybody likes to do bubble breathing, and every box has bubbles in there. We have some tissues in there in case they need tissues. There's also writing paper and pens and pencils and markers in each box. And each box has envelopes, and we did this for TF, but they're labeled like, relaxation skills, affect modulation. And so you open up each envelope only when it's the appropriate time. And so when you open up affect modulation, they can make a SUD scale out of pipe cleaners and, temp we put in there for them. We have the progressive muscle relaxation, the PMR script in there, the circuit story, and then we have little cards on a key ring so they can use it and practice it and remind them to do that. So you can do things like that you send home things for them. You could also send things to parents ahead of time if they do have email. So if there's like a PMR script or something like that you want them to use at home, you can do that. The other cool thing with the platforms, when you're searching platforms, make sure that you can share your screen with your clients, because you can pull up worksheets. And so, for instance, because a lot of my families don't have a print home, and for their homework assignments, I just pull it up at the end of the session and review it, and I have them do their homework with me at the end of the session, and we do it together with the parents. So they can answer the questions, they can talk to the parents about what we learned in session and that type of thing. And so then when you do that, you can give the whiteboard access to the client so they can actually draw on it and answer the questions on their own.
You are a wealth of information. I'm just busy writing all these ideas. I love the box of resources that you can send home that they can pull out as they need, and having the materials there, using the whiteboard. Love how you're thinking about how you've used PowerPoints for games that was mentioned in the articles. Those are all just such fantastic ideas. One of the things we have been talking about as a team, going back and forth of pros and cons, to create a book of all the handouts that the families can have and use throughout each session. For something like telehealth, this might be useful so that they don't have to try to print each time, but they could pull it out, and then you can also show it on the white screen and talking about it, but that will allow them to have that physical copy too.
So again, this is Martia, but myself, Nicola, and Reagan are going to be doing a 3-hour training on Tele over TFCBT on April 16th. The link's not out yet, but it will be, and we'll be going. That's how this is on my mind. I've been spending hours every day developing this, but so over a lot of this stuff, and it's going to be free, and I think they're even trying to give out CUs for it. But as part of that, they're developing some sort of website that will have resources on it that people can just click and download. Forms and the resources for each of the practice skills. And it could be an idea for ASCBT too, or not PSB. Where those things could be replicated.
Is the April 16th webinar something that all of us could join?
Yeah, as I get the link, I can send it to you. Let me look at the time. It's April 16th from 12 o'clock to 3 o'clock Central Time.
Right.
And it'll be available to everybody. It's a 500 Zoom account, and so hopefully it'll fill up.
Okay.
We want it to fill up, but we don't want it to overflow.
Right. We have some questions that maybe you have dealt with as you've rolled this out already. So some of our parents are single parents with multiple kids and are, struggling with supervision. And how do you manage the caregiver being on the telehealth session with their one child while the other children are busy, and how have you found any creative ways to manage that? And if when to talk to the caregiver with a child there.
So if you have a household where there's two kids struggling with PSB, a little bit more complicated. I mean, if the kid who's in PSB is in session, obviously in their own space, confidential, and feel like them going to therapy, right? And so they're in that room, and it's not like you would have eyes on them, right? Because they're in their therapy session, and they would be with or whoever the clinician is, right? And so the other kids in the house, if they don't have PSB, might not need eyes on, right? At that moment, it's going to be it's a juggling thing, I think. If they're a single parent and they have other kids, like they have like a baby, or they have, I guess you would think about it just like, what do you do when to group?
Yeah. Like
that parent might have to find daycare. They might have to have a friend or, tag team with somebody, those types of things. Because if they have 3 other kids and they have to come to group, they bring their other kids to group, and they have to figure that out. And so we have kind of brainstormed that a little bit, but, always try to think of these like, well, what would they do if they came in person?
Yeah.
It's the same logistics and same issues.
Really problem solve. So, if you needed to talk to the caregiver alone, are there 2 bedrooms where the kid with PSB could be in a room by themselves, the other children in another room, and the caregiver in between those 2 rooms in order to be able to be on session, but also, managing the supervision pieces of that. So really trying to brainstorm in terms of what could be addressed, and maybe doing most of the focus in this situation where they can't bring in a babysitter necessarily, that they do most of their session with a caregiver and child together, if that is a high-risk concern about the child being potentially sneaky and finding the other children while the caregiver's on the session. Comment was asking if the games and ideas that you shared in describing it, if there were any of those that you'd be willing to share with the team that was on the call. Maybe write a book, Paula.
Well, the answer is yes, but not today. We're trying to pull the ones. So one of the things that happens is you're developing these things is for instance, and I'm trying to think of the names, the PowerPoint that we developed about their changing bodies. I'm trying to think of the name of the book, but it's a book that we use a lot of times when we're doing groups.
Right.
And so we, copy pictures and use their words, and so because it's copy, you can do that, but we can't share it.
Right.
So some of the things like that, some of the books that we've scanned in, we can't do that with. So things that we've developed on our own, we can. So the other thing about creativity that I will tell you that I learned is that one of us is full of a lot of creative things, right? And I've learned very quickly to school counselors, because school counselors use whiteboards in their classroom lessons all the time. And so they've created a lot of, you can just put in whiteboard, lessons, school counselor lessons and that type of thing. And a lot of them have already made PowerPoint games and such things. Sometimes they're free. Sometimes you have to go on teachers' pages to download them. But also Teachers Pay Teachers is a great website or resource. A lot of their stuff is for $4, and they're sometimes free. And so they have a lot of things that you can download. Again, it's copyrighted, so I can't share it. And when you buy it, they say, you're buying a license, you can't share it. But check out some of those creative kind of things. when we're doing this 3-hour training, we are going to share resources for each of the practice skills. And so, again, I will, I encourage people to attend that. And then we also, like I said, we're trying to create some sort of website that will have all these things on there that we can, that are protected, that, that we can share. So the answer will be yes, but I don't know if I can just email somebody something right now today. If you have something, like if you have a specific question, I'll put my email address in this check box or this chat box. If you have like, what do you do for this or whatever, just reach out and ask.
Fantastic. And we are working to create a listserv for the people that we've trained so that we would be able to have a closed system to share ideas with each other. Stephen Fowler from our team is trying to get that set up quickly so that we can also share resources. And once your website's up, we'd love to link to it on NCSBY so that folks can access it there too. I wonder, another question that has come up is managing sensitive topics. So I think people are comfortable the rules, teaching the turtle, but what about sex ed, apology, really applying the rules that they broke to feelings? What are some tips that you've had on addressing those sensitive topics for telemedicine?
I guess my experience is that you just, you have the same kind of sensitivity in person, and so you kind of address it in the same way. I did a session yesterday with a boy, who was doing the affect regulation before, during, and after, and it's really, at first he gets like, I just don't remember anything, and so he kind of pulled out the wound analogy and how, sometimes it hurts to heal, and that kind of thing, and you're able to get through it, and he did a fabulous job. And so I think you just handle it kind of in the same way. The other thing that I have to say that we've found is that doing tele via this way makes you more even creative in doing it in person and group. Like one of my therapists said to me, she's like, she was doing we were doing a group on puberty, and we were breaking it up for the boys and girls, and she has one girl in her, that she would do it, and she's like, can PowerPoint that we used for tele? She's like, I really like that, and it's so much more engaging. And we're working on making a PowerPoint game for kids in the group for the sex state for the adolescent modification. And so, we're using some of the technology in group as well, because it just is much more engaging to be able to play a Jeopardy game about what the laws are in your state versus just, them and talking about them,
So true. It is. It's the same information, but they're more engaged, and then learning's going to be better because they're attending better. Yeah. Things that struck me in reading these articles was how the feedback was the kids actually enjoyed, particularly the older kids, use of technology, and that the therapists were pleasantly surprised how quality rapport can be established and maintained in this format. Wondered if you had any thoughts or comments given that summary from the articles.
Try not to do all the talking.
No, I should have changed this. I'm so glad you joined, Paula. You're a wealth of resource. And I think everybody is feeling very thankful that you've joined and were able to share all your ideas. So yeah, feel free to.
Yeah, I will echo that. I will tell you that when I first started down this road a couple of years ago, I'm in rural North Dakota. Like, first of all, there's only 5 counties in our entire state that are not mental health shortage areas, and we are rural. We're spread out. We're a big state, and we have no mental health providers. And so, tele was something that kind of was brought to us a couple of years ago, and I said, absolutely not. Counseling is something you do in person. Like, you need to build that rapport. You know, I was just, you know, it was one of those negators, and it just wasn't happening. And then somebody challenged me once and said, you know, because again, we're a big state and there's only 3 CACs in the states, and we're the ones that provide the trauma treatment and the PSB treatment. And some said, well, you know, Paula, I get that you provide really great services in Bismarck, North Dakota, but what those kids that 3 hours away in Dunn County, what do you do for them? Because we serve those counties as well. They come for interviews. You know, they drive 3 hours to get to an interview, and then they go home. And I just looked at them and I said, well, it's not able to serve everybody. And they said, I'm going to need you to think about that. And I had to be challenged. You know, I like to win. and that really, like, it ate at me. And I started, like, really thinking about this. And so then the other research article that you had sent by again Stewart, you know, came out, and I had no idea who Reagan was, and I started just Googling her name and found her email address, and I said, you know, I think we need this in North Dakota, and can you talk to me about this? And when I've heard her talk about me, she said, you know, Paula, you know, kind of talked to me for a while and wouldn't leave me alone. And so she ended up coming to North Dakota to do training for us. But it's been, like, so transformative to the way we do services now. Now I can say, and I've been keeping track of when we, you know, our baseline data of where we used to serve, what counties we used to serve mental health, and counties we currently serve. In the first 6 months in this project in North Dakota, we served 33% of the counties, just between 2 CACs, 33% of the counties in the state doing telehealth. And so now I can say that kid in Dunn County is getting the same type of services that if somebody in my county gets. And every single one of my therapists that I've trained in this, that's the first thing out of their mouth after their first session is, oh my God, I can't believe, like, how that felt just like if I was doing a session in person. And everybody's always taken aback by that. And then the second thing I hear is, oh, you know, like, kids seem to really like this. Like, they seem more interested in this, and then when they come in the office, they like being on the technology. They're used to technology, and they just really like using it. So, and the other thing is that more and more modalities are using it. So I remember, well, this PSB kid that graduated, you know, thought I would have to go into this big thing with the parents and explain everything, and you know, there to be this learning curve. And she's like, oh, we use this all the time to do telepsychiatry. This is how she meets with her psychiatrist. And she's like, so this is great. And, like, she knew all about it, knew how to use it. And yeah, as big as hurdles as you think it'll be is my way.
The second article that Paula mentioned, the N is small, 15 kids, but I was struck that not only at the amazing improvements in all areas measured, trauma, depression, anxiety, and behavior, but also that there were no dropouts. And maybe this will be a way to overcome some of those external barriers for families that were actually able to serve them more effectively by having this telehealth option.
So one thing that I'll tell, so this client that I was telling you about, this first PSB client, I've seen her in person at first, and she was driving an hour and a half to get to me, an hour and a half to get home. And it got to the point where I was seeing her once, maybe every month, once every 6 weeks, because they had so many issues. The car didn't work. Mom had to switch her work schedule. I mean, it was just a lot. They didn't have money for gas. And it was like you're pulling your hair out trying to get this kid treatment, and she really needed treatment, and the family was very invested. They just had all these barriers. And it was so amazing when we were, you know, I said, well, have you, you know, we're starting this new program, and I had reached out to you, Jane, and said, can I try this? And, you know, so the research, you know, one of the things that Reagan says is that not only will you have some of the same outcomes, oftentimes kids will graduate, like the treatment is quicker because you won't have things like snow days, you won't have, you know, mom was sick or switched her, you know, those types of things. You won't have those missed sessions because it can all just be done wherever they're at. And so I definitely have seen that. It's very cool. There still are sessions where they forgot, or, you know, they're still no-shows. You're never going to get rid of that. But but it's pretty cool.
Well, you're inspiring. I am so now motivated to get this to work really well across our many rural counties in Oklahoma, and appreciate that you join the call and share in your insights into this. And I will say for all the audience that we are very thankful for you to share your wisdom. And appreciate that. We'll keep an eye out for your email about your webinar and be able to join that. We'll share out those resources. Anybody else on the call, if you have questions or if you have other resources to share, feel free to send it and we'll send it out to folks. And I think we're out of time, but thank you, everybody, and I hope you are doing something to take care of yourself, too. Go breathe fresh air, walk through a forest as was recommended earlier, do things to enjoy your family and your time, and make sure you take care of yourself too. Thank you, everybody.
One last thing, Jane, I want to say one last thing is one of the things that we want to try out in the future when we can all be back in the office, because we have a satellite office, so we're in Bismarck and an hour and a half away is our satellite office, and we'll never have enough staff in a satellite office to run a full PSB program. Like the part we'll probably ever have is 2 staff there, and we've talked about could be the point where like mental health staff in office is having like a kid group there that tells into our kid group here, and a parent group that tells into the parent group. So you're really only having one group, but those kids aren't having to drive, and they're not like, you know what I mean, they're still supervisor have clinical staff on site. And so, like, combining 2 groups, and so it's in thought mode right now, but in my brain it works, so we'll see.
I'm glad you brought that up, and Paula would love, I know we're out of time, but would love to talk to you more about that. We've been talking about the pros and cons of group and how to manage confidentiality in those situations, so I would love to have a follow-up call with you and maybe have you join, and we can have another one talking about how to do this.
All right.